All right. All right, let me call to order the Gloucester Board of Health meeting of Thursday, October 6, 2022. It's approximately 5:30 in the evening. We are at the Harbor Masters Conference Room, and this is a hybrid remote meeting, which means that it is consistent with Chapter 107 of the Acts of 2022, and the meeting will be conducted by remote participation of the public. The public may not physically attend the meeting, but every effort will be made to allow the public to view and listen to the meeting in real time and participate when necessary. Additionally, all votes by the Board of Health during this and future remote meetings will be by roll call vote. If you are calling in on a phone, you can press *9 to request to speak. If you are watching on a computer or other device, there is a raised hand button that you can tap to press to request to speak. Please use either of these options during oral communications to be recognized to speak. Final note, the order of the agenda can be modified at the board's discretion. The first item on the agenda is an introduction of board members, and that's especially important for these remote hybrid meetings to just let Bobby Orlando, our recording secretary, hear your voice so she can have a better idea of who's speaking. So we physically in the room should go around. I will start. I'm Joe Rosa, chair of the board.
Eric Kaplan, member of the board.
Jacob Taylor, Food and Health Inspector.
Chelsea Goldstein Walsh, Regional Prevention Director.
Lee.
Lee O'Leary, Financial Specialist, Recording Secretary.
Cindy Junker, Interim Public Health Nurse.
Director of Public Health Department.
And we have,
Don Ganem.
oh, what do we have? Don Ganem.
Perfect time.
And Claudia.
Yeah, Claudia Schweitzer, Vice Chair, Board of Health.
And also joining us from the department is Bree.
Bree Gray, Health Inspector.
And joining us from the Biosafety Committee is Maggie. Can you hear us?
Maggie Rosa joining you.
All right. The next item on the agenda is an opportunity for the public to speak up to 3 minutes for an item that is not listed on the agenda. Lee, is there anyone?
I don't see anybody with a raised hand.
Okay. The next item on the agenda is the approval of the minutes of September 1, 2022.
I make a motion to approve the minutes for September 1, 2022.
Second,
Any discussion, changes, edits? None?
No?
Let's roll call vote. Claudia?
Yes.
Eric?
yes.
Joe Rosa, yes. John?
Yes.
Next item is the same for the minutes of September 22, 2022. That was a special amendment meeting we briefly had. I have a motion.
I make a motion to accept the minutes from September 22, 22.
Second,
Any discussion? All in favor? Oh, yeah.
Do we have to do roll call?
Yes. Claudia? Yes.
Yes.
Eric?
yes.
Joe Rosa, yes.
Yes.
Don, yes. Unanimously approved. All right. Next item on the agenda is the director's report.
Oh, it's director's report.
That's you.
So the reporting this week is essentially we are doing a kickoff event on October 17th at the Community Impact Unit. Is yet to be named. It will be an initiative done by the Gloucester Police Department, Health Department, aimed at our older citizens to help them feel safer here in the community. All other reports will come directly from the staff leading those efforts. And we do have one person who is not here. She is a new member. I introduced her last month. That would be Leslie Whelan, who is our new Title V inspector. And that's all for my report.
So for specifics, the regulatory reporting. Jake, you're first with food safety.
Okay, I'm Jake Taylor. I'm your new food and health inspector. Since our last meeting and everything, we had a very busy month. With the children going back to school, basically priority was to try to start and go through every single school. And that involved, besides just going through the kitchen, meeting with all the staff, their inventory, their proceedings, through feeding the kids, had to go through, check every bathroom at the nurse's office, and just the general sanitation of every school on the island, from GHS to O'Malley to every middle school, elementary school, and preschool. Other than that, we've had 10 of the special events in the city, including block parties, the Harbor Loop concerts, Brazilian Independence Day, multiple day events, including Schooner Festival, the Mayor's Race, all of which had retail vendors, food vendors, all of which need to be inspected. Other than that, we had 42 regular inspections on restaurants, at home cooks, restaurants, mobile vendors. We had one case of Vibrio within the past month, which included 2 different establishments on the island needed to be inspected for the state and whatnot, which basically includes gathering order sheets, paperwork, interviewing the cooks, the facilities, and where they get all their food from, and all of that information is transferred over to the state for their state inspectors to take care of any based in investigations. So very busy month on this side.
Yes, indeed. Is there any issues outstanding?
As of right now, no, just basically general complaints. The most complaints right now, just being at the end of the summer season, a lot of the restaurants and facilities in town are just sort of clearing up and everything like that. So trash complaints would probably be the biggest on my side, but usually those are taken care of event to event. So all of those, so nothing outstanding at the moment.
Ready for
There's
this?
many more to go through. Yes, sir, very much so.
Housing, Bree.
I'm Bree. I'm the housing inspector. Also handle the body art, tanning, swimming pool, hotel motel inspections. Jake's helped me tackle beach testing this summer. That season ended September 9th, with our last test being September 7th. Overall, it was a pretty good beach season, minus the creek. I think our only closure this summer was Pavilion Beach for a little bit in July, but all in all, a pretty good season. As far as my work goes for September, I did around 22 certificate of rental dwelling inspections in 16 different buildings. So pretty busy. We had about 9 complaints come in, and those were varied between state sanitary code landlord tenant situations and general nuisance complaints, but they're all being handled. So nothing really outstanding with those. I know a few months ago we talked about body art regulations got brought up. We have someone interested in doing microblading. Our current body art regulations, if we remember, do not have anything in them pertaining to permanent makeup. So I did reach out to some of our neighboring cities and towns to see what their regulations looked like. I found that each municipality kind of has varying requirements when it comes to training and certification requirements. But also these municipalities have recently received a grant to work on updating their regulations, and body art is one of their top priorities. So they're currently working on creating draft regulation, which they plan to share with body art practitioners in their communities to kind of get feedback. I've not received any further updates on where they're at in this process at this time. So we'll see what occurs in the future with that, just waiting to hear back. And I also have been working with Ryan and our IT department to get us more involved on SeeClickFix, which for anyone that doesn't know is a reporting service that allows residents to document concerns. It's mainly used by DPW department right now, but we're working on building out some categories to make it easier for residents to report health department related concerns. It could be general nuisance complaints, it could be even housing complaints. So we're going to work to see what we can do to get that so that we can actually get the complaint documented. It'll be easier for the residents to document it and send it to us. They can upload photos and we can just overall track the complaint better. So that's just something that's coming down the pipeline.
Bree, on the body art, Gloucester is not part of that consortium of communities that have a grant to come up with regulations. Is that correct?
We are not part of the grant.
But we hope to hear from.
We hope
their-
to hear, yeah, I had spoken with the public health nurse in Marblehead, and she was gonna keep me informed on what happens with that and send me any information that they get from like the draft and stuff.
Thank you.
And word before she moves on, regarding the, Bree, you want to address the Magnolia Variety Store violation?
Yes, so we had just received, we were kind of a CC on this. Magnolia Variety had received a suspension of their tobacco permit from the state, from the Department of Revenue for not having something in regards to their regulations. So we were just, we got a CC letter about that.
That was a failure to pay revenue, right? The revenue office, the state losing money, and big things happen when that happens. So, all right.
Thank you.
Thank you. Title V inspections. Mary Ellen, you're gonna fill in there.
So our Title V inspections have been going well under the new leadership of Leslie Whelan. We are catching up somewhat with our backlog of inspections. We ask the public to still be patient as we catch up on that. Larry has been done more than yeoman's work in helping support that effort. And we are also trying to come online more, and the department is always open during working hours, but we are trying to funnel those needs that are most urgent at the top of the piles, but please keep in mind, we are also trying to make up for lost time.
Thank you. Changing gears, communicable diseases. Cindy.
Cindy Junker, interim public health nurse. So the communicable diseases report from 9/1 to 9/28 of 22, which is reported through MAVEN, which is Massachusetts Virtual Epidemiological Network. We had one Campylobacter probable case. We had one Giardia probable. We had one Group B strep that was revoked. We have one Hep C probable, 7 Lyme suspect. We had 105 confirmed COVID, and we had 2 probable COVID and 5 suspect. And next, my flu clinics. So I have a list of flu clinics that I have planned and started already. On 9/27, I had a public safety clinic for the fire department and police department. I vaccinated 20 firefighters and police that day, and the next day, the 28th, I wasn't as successful. I only vaccinated 10 firefighters and police. I also went to 2 homebound residents and gave them their influenza vaccinations as well. We also have planned on the 12th Pathways for Children's staff and Open Door staff from 9:30 to 11. We also will be doing day-by-day staff that day. On the 13th, we have a public clinic at Rose Baker Senior Center from 1 to 3:30. On the 17th, we'll go to McPherson Park at 10 a.m., be at Lincoln Park at 12 p.m. On the 18th, we'll be at Sheedy Park at 9 a.m. and the Clark Building at 11 a.m. And on the 20th at Central Grammar at 9 a.m. and Poplar Park at 12 p.m. Then we will go to the school department and we will vaccinate students at the high school on the 25th. And we will go to East Gloucester that day as well, and then end up at West Parish in the afternoon. On the 26th, I'll be at Old Mailey in the morning, Beaman midday, and Plum Cove in the late afternoon. And on the 27th, we will finish up at the preschool and Veterans Memorial. And then in the afternoon, we will have a City Hall clinic for any staff members or any employees of the city.
So that's terrific. Much of this, all of that is in our packets.
Yes.
But is this posted throughout the city or?
So that is Sharon Furtado and I planned that, and she posted that around the elder
Elder
housing
housing, yes.
units. And I have received many of the forms back, which I'm having Carol Mondell input into color
Great.
so that it's easier for me that day. The information is in about all of the people getting vaccinated. All I have to do is vaccinate, enter that information. We have received, I ordered and we have received the bivalent, monovalent Moderna, 100 doses. So I am offering that at first to the people in the housing, the GD Park, McPherson, et cetera. When they come for their flu vaccine, I will also offer COVID. If they haven't received it at that point, we'll be giving it simultaneously. We just give one in one arm and one in the other,
Right.
which has been recommended.
Yep.
So far, so good.
No, that's terrific. You're obviously doing a lot of work, and thank you for stepping into
Oh, you're
the
welcome.
breach here.
Thank you, Cindy. Can I just, Cindy, I assume you have a group of volunteers. You're not doing this yourself.
So actually, Bridget Nelligan, who is sharing this position with, however, she's in Portugal right now. Poor Bridget. She will be back, and so she and I will be doing most of these clinics. And I do have a volunteer who volunteered last year during COVID, who's coming back to help. And I also have Beth White, who will be here helping as well. They've all been vetted properly, so.
And the mayor's wife has also volunteered to assist.
Depends on what kind of need we have. If we don't have a huge need in each building, then I'll just stick with like 3 of us because it will go along.
Well, I was just thinking of the big citywide ones, like at the senior center or at City Hall, where, I mean, I just know in the past, there've been like 6 or 7, nursing stations.
For the public clinic at the Rose Baker Senior Center, yes, we will have numerous nurses and numerous.
Mhm. Thank you so much for stepping in.
You're welcome.
Yeah.
Okay, I believe that the BioBot reports have been posted on the website, but our last one looked good. We are only, our sample was higher concentration level than 10% of all qualified samples collected in the past 2 weeks, which means, we're probably doing a little bit better right now. We have little surges and ebbs and
The very last
flows.
sample that I'm aware of, we did tick up. We're
Well,
at-
this one was from September 14th, and I only saw that one last. The September 7th was a little higher, but those people had recovered because our sample that week was higher concentration levels than 75% of all qualifiable samples collected in the past 2 weeks. So we did a little bit better.
Okay.
Is there any way we can have that sent to us like we used to have it sent to us?
You don't get these sent to you anymore?
No, we don't. No.
That's really exciting.
So I wasn't getting them sent to me either, so Marilyn made sure that they did get sent, and I just received them this week. So,
Send them along
Yeah.
to us.
Yeah, so we used to get them every week.
Yeah, I still do, but I may well be getting them from BioBot directly, so I can certainly forward them to you without any
I
problem.
think Max used to forward them to me, and I'm not sure if he forwarded them
Yeah,
to.
Max probably forwarded them to.
I think Rachel.
So we've had a
I
little
can-
bit of a hiccup with regard to the BioBot reports in that we're not sure where we stood with the contract and who was paying for it. So we have now cleared that out, and they sent me all the back reports that we were missing. And so those are part of you all have them in your packets, and going forward, we will go ahead and forward them on to you. Then they will be posted on the website as well. We're, again, trying to catch up quite a bit. The staff is working on understanding and our capabilities with regard to actually posting things on our webpage. That's also a learning curve. So again, we appreciate your patience as we learn what we need to do to get in line with what's expected. Thank you.
So one of the things that, to just follow up at this point, since it seems most appropriate, one of the things that Mary Ellen and I have talked about is ways to actually use this information. And so one possibility that is just spreading the information, is to utilize the electronic displays that the city occasionally puts around the city, highlighting flu levels, if we can, if there's a quantitative measure that we can use for that, maybe cases reported by the state, or if we have our own numbers, and then the BioBot results. And we can tell people that take caution, you know, levels are elevated. We'll have to discuss at some point exactly what the criteria are. But I think that would be a good use of this data that some in the city would appreciate, others will ignore, but they're not being forced to do anything. They're not being forced to read them even. But I think it would be a good use of the information of the population. So I don't know what has to happen to make that happen. Maybe you can discuss it at a director's meeting.
Right, so I'm gonna reach out to the police. I have scheduled a meeting with regard to that to see what our limits and capabilities are with regard to using those, that signage. And we have to determine, you have to determine as a board what will necessitate that happening. So we can't, you have to give me a level or percentage of what,
Well, what it
you want it
says,
to
I
happen
mean,
and
I
what you
would
want it to say.
just as soon have it throughout the winter months, all the time.
Yeah, they don't have, I'm sure they don't have I mean, I'll check, but I don't know that they'll have enough or to just post just for the public health department, but
Okay.
I will certainly ask.
Well, you can certainly ask that, and then we can decide what it should say,
Okay,
and how we want to convey the information.
okay.
But I think, well, we'll see. I think it would be useful information throughout the winter months, both for flu and COVID, because flu season, some are saying could be back. You know, we haven't had our immune system trained for 2 years, so we could be very susceptible. Get vaccinated.
We're working on it. And with that being said, we will play it by ear to see how our clinics are utilized as to if we will plan more.
Yeah.
And we'll see how our COVID boosters are used, if they're used up in the first few days. Once I prove that I've been using them, I can then order more.
Sure.
But I have to prove to the
Right.
state that they are gone first before they'll send me anymore.
Good.
And it's
Thank-
kind of nice, this new booster only comes in vials of 5, so if I only had like 3 people, I wouldn't feel as badly if I had to waste just 2.
And we also just received a supply of PPE gear so that if we're gonna bring it to the flu clinics and distribute masks and COVID test kits as needed and requested. So any leftovers that we'll have from that to make available to the public upon request.
Good. All right. Prevention, Chelsea.
Hi, everyone. This is actually the first time I'm meeting some of you. So my name is, again, Chelsea Goldstein Welsh. I'm the new prevention director in the health department. Been here since the very end of August, so new to the role. I've been working with Stacia Satterfield, who you all know, I imagine, very closely, as she's a wealth of knowledge. And she helped me prepare this presentation for today. So I just wanted to give a very brief overview of the work that we've been doing, with knowledge that I'm not trying to get deep into it, but I'm happy to answer any questions and provide follow-up information as requested. So our department is primarily focused on primary prevention of youth substance use and promotion of mental health in the community, which also involves strengthening trauma-informed care and practice and policies with our partner agencies. We manage 6 grants currently, all the way from the federal level down to the community foundation level. And all of those grants, again, are involved in youth substance use prevention and mental health access. And so just a quick rundown of the grants that we currently have. We have a Partnerships for Success grant. It's a federal grant under SAMHSA. It's a 5-year grant. We are entering year 4 of 5 of that grant. And that is specifically aimed at strengthening the trauma-informed policy and practice across our community sectors, particularly in the schools and in our police department. We have a Mass Call 3 grant, which is a state grant through the Department of Public Health. It's a 2-year grant with the opportunity to reapply for additional funding. We're in the second of our 2-year cycle. And that's a regional grant, so it involves 7 partner communities. We're the host community. The other communities in that region are Rockport, obviously Gloucester, Essex, Manchester, Ipswich, Beverly, and Danvers. And that is aimed around implementing the strategic prevention framework and using data to drive decision-making and inform policy and practice. And that specifically involving youth and youth leaders in decision-making and kind of training them and empowering them to learn how to read data from the Youth Risk Behavior Survey to inform their own strategies as well. Part of that grant is actually a CDC pass-through to the state, our OD28 grant, which is specifically focused on opioid use prevention and treatment. So that partially funds the community health navigator position at the police department that allows residents to be able to connect to treatment. I'm trying to go quick, so if you have any questions, stop me. We have another state grant through the Department of Public Health, our Early Childhood SORPEC grant, which is like an extension of our Mass Call 3 grant into the younger years. So we sometimes refer to it as our early childhood grant. So it's implementing primary prevention starting at a young age, like birth through 11, and then kind of Mass Call picks up in the adolescent years. So again, infusing trauma-informed practices and substance use prevention, mental health promotion in both young children, but also in caregivers and in providers as well.
So when you mention young children, is it through the schools that it's implemented? Or?
Yeah, it's through, yes, schools, as well as some of our partner agencies such as Pathways for Children, Children's Friends and Family Services, Unity, which is a program of Children's Friends and Family Services, Action. So the great work that's involved in our coalition really does pull in community members who live and work in the community who are in any way involved in, youth development. So that does include schools, but also many nonprofits and volunteer agencies.
Do you know what the acronym is, SORPEC?
I do, and I will look it up for you. I believe it's just the SOAR is a state opioid response.
Okay.
So initially it was aimed at targeting children and youth who were impacted by substance use because their parent or caregiver was impacted by substance use. So the youth themselves weren't directly using, but their caregivers might be. But that has expanded to obviously involve the entire community as a primary prevention strategy. So housing, we collaborate with housing a lot to be able to access vulnerable populations who may be on the lower end of the socioeconomic status, to bring programming, information, education to them. This grant in particular, but all of the grants really do focus on reducing barriers to access and strengthening protective factors. So there are a number of coalitions that we don't necessarily run, but we sit in on because we are seen in a community, which is a testament to the great work that's been done. We're seen in the community as a thought leader around youth substance use. So people think of the Gloucester Health Department as a key partner and invite us in on lots of coalitions. So we get to learn about what other people are doing both in Gloucester and regionally. That informs our work.
Great. Good.
Yeah, sure.
I have a question. I'm just curious. This is great, but do you have enough mental health providers, social workers, psychiatrists, psycho?
Great question. I'm a clinician myself by training, so I'm a big mental health advocate. I mean, nationwide, there is a shortage of mental health providers, particularly mental health providers who serve youth. And we've seen that, we saw that pre-pandemic, and then, since the pandemic has begun, there's been what some people are calling a mental health crisis, where there is nationally and locally a shortage of providers. So we do involve local mental health clinicians in our coalition work. And so some of the access, right, that we're trying to increase access is around connecting people to resources that exist, but with the knowledge that there are wait lists and they're long. So we do our best to both advocate for increased support for mental health services, but also to try to break down the barriers that might exist that might stop someone from being able to access treatment, whether that's transportation, whether that's insurance, whether that's like scheduling, right, how to fit that into the schedule. So I know Gloucester Public Schools have really and continue to really prioritize mental health in the schools. Again, I can't speak to the schools, but I know that they're prioritizing social emotional learning and mental health for their students, and that's one way to break down that barrier for the public school students to access mental health services in school. Again, with insurance on an insurance line basis.
So I encourage, if you haven't done already, I encourage you to meet with Claudia. And
I would love to.
I'm sorry I'm not there tonight, but I look forward to, I'm going to be away for 2 weeks, but after that, I'd be happy to set up a time to get together.
Yeah, I would love
And-
that.
Yeah, and I assume you've been in touch with Amy Cam, I assume.
I have. I was just in her office yesterday. Yeah,
Good.
I'm going to be in touch with her as much as she'll let me. Because I want to, to support the work that they're already doing. I think that's oftentimes the role of our prevention team, is to strengthen and support work that's already being done rather than trying to reinvent the wheel.
So just say Amy Cam, I mean, I think this speaks to the commitment of the Gloucester schools to mental health services, that Amy Cam is now the head of mental health for all of the school, for the whole school department. She was the school adjustment counselor for years at the high school. And she's wonderful, and she has boundless energy. And there's a lot, obviously there's a lot of work to be done, but she's a good person to be connected with.
Yeah, and she gets stuff done,
Mhm.
like right in the moment. So yeah. Thank you for your questions. I have 2 more. I don't know if you have time to hear the last 2
Sure.
grants real quick.
That's fine.
Sorry, just to run through our last 2 grants that we currently have are through the Tower Foundation, the Community Change Grant, which has allowed us, going off of the need for more mental health support for young people. This grant is allowing us to implement teen mental health first aid in the schools, and hopefully to eventually extend that to our regional partners as well. And that's a peer-to-peer model that helps train youth how to recognize signs of a young person who may be struggling and how to intervene and get them the support they need. So we know that teens tend to tell their friends, right, before they might tell their parent or another adult. And so it trains teens to know how to recognize when a problem their friend is sharing with them or something they notice about their friend rises to the level of needing adult intervention and mental health intervention. So we're really excited. That was part of what I met with Amy Cam about yesterday. That foundation had been laid well before I started, but I'm trying to carry the torch forward to make sure that happens in conjunction with the schools. Last grant, real quick, through VI Leahy Hospital, allowed us to develop and implement the youth risk behavior survey in the public schools in an online format and translate it into 3 languages, which is the first time it's been offered in Gloucester online. And that is a really rich source of data that we use both to report to our funders, but also to inform our programming. And that covers, it's called youth risk behavior, but it covers things like bullying, mental health, and substance use, as well as protective factors. And that is for all middle and high school students, 6th through 12th grade.
And it's administered during the school day.
It is, yeah, it's administered during the school day. So we had a very close partnership with the schools. They were very generous in allowing us to access the students and to take valuable school time to have the students do the survey in school.
So what's the sense of the group as to the frequency with which that should be done? Every year, every 2 years?
It's done every 2 years. So we're hoping that that can continue. It's based off of the CDC's Youth Risk Behavior Survey. So it's a national kind of model that localities implement. So typically it is done every 2 years. I think for many communities, there was like a year break because of COVID, but typically it is every 2 years. And that data is not available yet, but it will be presented at a school committee meeting in November. And then we can make it available to our partners and to the public.
Thank you. Is that it?
It is. Sorry, that was more than 2 minutes, but thank you for your questions.
We just want to point out the fact that Chelsea and Rosalie Frontero helped us on Safety Day and had a great showing. We gave away a lot of items and had a good amount of contact with outreach for focus groups that we're working on and that we are in the midst of at this point. If you don't have any further questions for the staff, I'd like to be able to dismiss them so they can end their day. if you don't
Sure.
mind.
Thank you so much. Appreciate it.
Yeah.
Thank you.
Thank you so much. Thanks for your time.
And Chelsea, I'll reach out to you when I get back.
Yeah, I would love that.
I look forward to it.
Me too. Thank you. Thanks for your time.
Thanks very much. Okay, see you tomorrow.
See you all.
Thank you, guys.
Thank you, Chelsea.
The next item on the agenda is an update regarding the biosafety subcommittee. Maggie, you're on.
Thank you.
Can't hear
You're
you.
muted, you're muted.
Yep, I am now speaking. I provided an update for Mary Ellen, but briefly, the Biosafety Committee has been established. We have the basic formalities established, and we met for the first time via Zoom last week, where we, on the basis of Mary Ellen's nominations, Lynn Jackson was nominated and elected to be the chair, and I, your Honourable Maggie Rosa, was nominated and elected to be the secretary. We reviewed the mission of the organization based primarily on what Joe had provided as by way of objectives. This will be fleshed out a little bit more to make sure that we are comfortable with what we're supposed to be doing. We will also be reviewing the current NIH guidelines to make sure that they are that the Gloucester guidelines are current with the NIH guidelines. We decided that for the first few months we should meet on a bi-weekly basis, and thereafter more or less as needed to provide the Board of Health and the community with the necessary guidance that is deemed necessary. I think that's probably it. Mary Ellen can probably add some more to it. But we did recognize that we have a broad spectrum of expertise, which is good.
So we're very grateful to the volunteers of the committee. Eric is being one of them as well, and it should be well represented. And we need to meet in the next few weeks to close up the mission and have some decisions moving forward. Eric, would you like to add anything else to that? Very grateful to all of you. Thank you.
Thank you.
Thanks, Maggie, for doing this.
Oh, always a pleasure, always a pleasure.
Maggie, you're dismissed too, if you would like.
She's waiting for me to get home so that she can eat.
I see. All right. Moving along.
New business. Nomination of a new board member to replace Kelly. So I think the only thing I can report in that regard, I don't know whether Mary Ellen has any new information, but of course it's the mayor's appointment that has to be made, mayor's nomination and actually appointment. And in talking with him probably 10 days ago, he is on the case. He's already identified one promising candidate who I think he's probably interviewed by now, but he wants to interview others, and hopefully things will move appropriately.
I'd like to encourage the public, if there is any public listening to this, that this is a open process. You're welcome to submit a letter to the mayor if you would like to serve on the board, and you'll be interviewed for consideration after that is reviewed. So thank you.
Yes, good point. Any
And
other?
you know, one thing I just wanted to say about that, I don't know if the mayor's aware that in the past we've had a plumber on the board, you know, that it doesn't have to be a nurse or a medical professional. And that how helpful it was to have a plumber. And so I'm not sure that, you know, he's aware of that. I know when we had more kind of involvement in trying to help find somebody, that's the first person that we were looking for was a plumber.
So the objective of the health department, so for those of you that are listening, is we are very much like a three-legged stool. We have communicable diseases, prevention, and regulation. And we're well represented by the medical community, so we would look for representation in one of the other two like stool. So I have made the mayor aware of that, and knowing that we're trying to broaden the search, but again, is up to community nominations or self-nomination to get that to move forward.
Right, I did tell the mayor that myself
Oh,
also.
good, okay. Because when Rob Harris was on the board for years, it was very helpful.
Any other comments about that issue? No. Old business. Number one is pest control in the public schools. This has been an ongoing issue. And Eric, I don't know whether you want to make any comments.
I did speak to Suzanne Egan, who sent me I asked her to send me a short note on how we should present this. And so it should be on the agenda for the next meeting.
Okay.
And I will try to supply, we already have got material from all the schools from DMP,
Okay,
I think is
that's
the name of
good.
the pest control. I think everybody got it.
Yeah.
I went and just looked at the O'Malley Middle School to look at all of pesticides. But everybody has that. And I think I sent you the reply from my cousin.
Yeah.
And I'd like to present that again at the meeting. This is what she said, is it has to be presented at the meeting so
Yeah.
that it's documented.
Sure. that
And
is
then,
public,
and then it's
right.
public record so that she can receive all that information once it's in the record.
So what's important to note in this is I have reached out to both DPW and the public school system, who are the parties most responsible for pest control, and they are following state regulated mandates. So there is, as far as our authority, we can make a recommendation, which is what you plan to bring to, which has, by the way, already been presented. It's already been a part of the board's minutes. So there's really no need to bring it up again to the next meeting. The request, the public request that was made has been addressed. So as far as this board's responsibility and accountability and authority goes, we need to close this case because we cannot do anything moving forward.
So
Every bit of information that we have received has been distributed. And while I appreciate Ms. Boucher's concern for the children, there's nothing that this board can do, and the time spent is not necessarily going to move anything any further as far as our authority is concerned.
So I was misunderstood. So the information you were talking about regarding what the schools and DPW, that's not new information. That has been already
If it's in the record.
It's in the record, and it has been shared, and this is the most important thing to note, this is not regulated by the city, it is not regulated by this board, it is regulated by the state as to what, which pest controls can be used, and that's what they follow, so there are no recommendations. We could make recommendations, but it's not really within our authority, and I think it would be a poor use of our time going forward.
One of the things I found in the records, and I just want to make a comment about it, is that it's supposed to be, they're dated, all of the times that they're done. And except for one in 2019, there have been none since years ago. They're supposed to be done on a yearly basis. Something is wrong with the way this looks. So that's why.
What is to be done, I'm sorry?
The IPMs and the list of pesticides and all that kind of things. When I look through the things in O'Malley School, look at the dates are years ago. They're not supposed to be years ago. They're supposed to be current. So we may not have anything to say about it, but I think we should say something and try to move people along to do what they're supposed to be doing.
Well, that's the board's decision, as I said. So do you want to next steps for the next board meeting then, so that I can report out? Or this has to be discussed at board meetings if you want to review it again, to put it on next month's agenda as well, to discuss what you're finding and.
We certainly can, and with the understanding that the end result of that might at most be a letter to the concerned, the responsible parties in the city, which I guess are the schools and DPW.
I think that would be very helpful, because it's great to have all these, policies about how things should go, but if they're not being followed, and it does affect, pesticides affect the health of children, that I think it's incumbent upon us to at least make a recommendation based on the information, that we receive. We realize it's not up to us, but we can certainly recommend or express our concern as a board.
Which I believe has been done over the past year several times, has it not?
Yeah, well, there's been communication with the school committee, I believe. I actually don't remember what.
Yes,
specific-
I spoke to Laura Wiesen, and she brought it up, and we wrote a joint letter. The two boards wrote a joint letter.
I think requesting information, right?
Yeah, yes.
So
You were asked, the corrective action you want to see is that the DPW, which controls the setup of these pesticides, to declare what are the ingredients in these, is that what you want? Each is supposed to be done yearly? It hasn't been?
there's supposed to be, I believe, a yearly plan called Integrated Pest Management Plan.
And in that plan, they're
supposed to
elucidate
highlight
what's in that.
When they use things,
Sent to us.
It hasn't been done for 3 years, 2 or 3
You can
years.
look up Gloucester in the list, and it'll tell you, it has every school. You can just click on it, and it'll tell you all the things that you need to know, and the dates.
Right, and when you
I
put
only looked at one of them because I didn't have time to really go through today. We had a meeting tonight. And after I talked to Susan Egan. But I was surprised by the dates.
And is there a state requirement that it's supposed to be done updated yearly or yearly year or two?
I thought it was yearly, but I don't know. So we're not answering your question.
Well, no, I was just trying to find out what our objective is.
Right.
What corrective action we want to do.
Yeah, so
We can't do anything, we can make suggestions. Only.
To the ingredients, if you will, right, to the items that they're using, but the issue is there's no information out, there's no current information out there. Is that what Mrs. Boucher's original complaint was? What's being put in the playground, what's being put around the schools? Wasn't that her complaint? What are we putting our kids
Right,
exposed to?
right.
We didn't have the answer to that, right? Okay.
And we can't provide that answer. That should be as my understanding, should be part and parcel of the IPM, the Integrated Pest Management,
Which is comes out of
Plan.
DPW?
which I believe comes out of DPW, because DPW is now in charge of the
This is the
facilities.
problem.
Okay, so why don't we just
We don't
speak
know,
to the
we
director?
don't know who's responsible. It seems like we don't know who's
That's
responsible.
really where the Board of Health can come in a useful way, is to get some clarity on where this.
I tried.
Who's trying to.
I tried.
And I don't want to make this a major issue for Mary Ellen, because it's only informational for us, and we will write an advisory to someone. We can't, it's not for us to impose any.
No, but if citizens of Gloucester are asking, what are these things that our children are in contact with, to pretend they should be able to have that information, right?
They should.
So that's the role that we should play as a Board of Health, is facilitate this
We
information.
can certainly try to facilitate.
Because if we can't find this information out, and we certainly have not been able to, certainly someone like Mr. Boucher can.
We have found that information. That information was found and shared, as far as I understood before, by my predecessors and shared, I believe, with this board in attachments, because they are in communication with you all from DPW, as well as,
You remember saying it?
No, I don't.
it may have been before, I don't know if it was before you
It
two.
was right, I think it was right when we came on, right? It was really,
It's been more
It's
recent.
been a
than that.
year.
It's been recent that we got that information. Because I asked for it for a long time, and I didn't get it till recently.
okay.
I can, well, you just decide what you want me to do.
But these pesticides were approved at the state level,
Yes,
for use by the cities and towns.
yes,
We have no.
Presume so.
Yeah, we have-
that's yes.
That's the crux of the problem. That's the problem.
But that we don't.
You'd like to
That we
see
don't
more.
know.
Right.
It's the one folder I did not find. Jeez. Folder with me. Apologies.
It's all right. So Mary Ellen, you and I can get together over the, and try to find what information has been distributed. And we can,
I have it, I can send it back
again,
to you.
maybe we can do that. And again, we can put it on the agenda for next meeting, if only to refresh the board's memory as to what has been. Anything else on that issue? Good Harbor Creek pollution investigation update.
So we, the contractor Woodward and Curran was able to take a wet sample. They have the sample, they have issued a preliminary report. I'm waiting for the data before they can comprise their final report. I am bringing in a third party, again, reviewer to make it more understandable for us. Yeah, to digest it down to something that we can all understand, since it's not.
Was there enough rain? Was there enough rain?
There was enough rain, it was
for them to
just
do this
barely
thing?
enough rain within the 2-hour limit, so I was very happy to have them
Finally.
capture that. And I'll let you know when we know more.
That'd be great.
Okay.
Yeah.
Tobacco regulations and amendment. So I'd rather not have a full-blown discussion tonight. But what the recent violations have highlighted the need for this board to at least revise the language in the tobacco sales regulations to make them clear. So there's a couple of typographical errors, but more importantly, in reading, especially, I believe it's section, I wrote down here, section E in subsection 12, it's not obvious what the procedures are. So I requested the board, it's in your packet, the current regulations are in your packet, to have a look at those, particularly section E, and then come to the next meeting with your sense of how those sections might be made clear. In doing so, an important issue that, since almost all of you are new to this, an important issue that that we should discuss at the next meeting is the question as to whether the intent of subsection 12 is to reduce over time the number of retail establishments able to sell tobacco and eventually have that go to zero. And there's a lot of arguments that we can make about why that's a good idea. And there are others that we might think otherwise, that we have other mechanisms to prevent sales to minors, et cetera. But let's not have that discussion tonight because we'll be reading and asking questions at the same time. So let's have that for a major discussion next meeting.
Joe, can I just ask, because I was scrolling through to try to find what you were saying. What's the section that you were saying?
I believe it's I don't have
E12.
B12.
B12?
You might say what. Nine,
So
I think.
Joyce wants to be identified.
Oh, E12, you have it, you marked it off? There's some markings on it.
Yeah, the lines, Claudia, the lines are because of typos
And then-
in that C should actually be section B,
I see.
Yeah, there's,
C and E should be D. But that's not what we need you to concentrate on.
Okay.
On the words.
So I'm sorry, because again, I was scrolling through to try to find it. Which section do you want us to work on for next time?
to look at section E, subsection 12.
Maximum number of tobacco permits.
What is it?
Maximum number of tobacco. sale
Yeah,
permits.
maximum number of
Tobacco.
tobacco.
sales permits.
Okay,
And it would be very helpful to actually review the entire regulation to make sure it does indeed state what you understand it to state.
Yeah.
Since we've had some changeover in the board since the regulation was formulated. I believe Joyce. Joyce, did you want to be identified?
Joyce, please speak. Is that
Actually, to the board members, hello, Joyce Redford, the director of the North Shore Cape Ann Tobacco Control Program. And interestingly, it's exciting to hear there's all kinds of new people. Unfortunately, I've been around for 23 years, so you've got old blood here. My understanding was we were here about Lanesville and not about the regulation. Am I incorrect in that?
Well, Lanesville went ahead and paid their fine. That's been-
Okay, I was unaware of that. I apologize.
I apologize, we just found out.
Okay, and so with regards, I have not reviewed, nor do I have it in front of me, your regulation, because I didn't know that was a component of the meeting this evening. However, I think it's a good idea. It's never a bad idea to look at your regs. The other thing is the last update for those members who were not here, including Mary Ellen. The last decision was not a whole update of your regulation, but rather the suspension of the permit when there is a violation of a sale to a minor for the first time, and that was the result of state law. So state law said, in the case of a first violation, when it's a sale to a minor, it requires a suspension. And at the time it said it gave the boards the discretion to say anywhere between 1 day and 30 days. And the board voted 3 days, which was reasonable given that you already for many years have said on a second violation, it was the fine plus a 7-day suspension. And on the third, within 36 months, it was a fine and a 30-day suspension. This has been in play for many years in Gloucester. However, what we didn't do was update your regulation more globally to incorporate all the language of the state law, which I think is paramount to do, in addition to whatever clarifications or other decisions or nuances in your regulation that you feel are important. I will tell you, Joe, you and I were both here. Permit capping is certainly a focus. It's very important in terms of the impact it has on initiation for young people, especially if they even as simply as walk by an establishment on their way to school. There's like a 64% increase of likelihood of initiation if they're walking by an establishment with all the advertisements. So density is a really important part of our regulation. How you want to clarify that or determine how and what it is. But I know it's important. It's what it was when you updated your regulation in the past. And I think it would probably make sense to look at the sections we're talking about, myself as well. Send it to our technical assistance team, which for those of you who don't know, is an attorney who represents tobacco from Mass Municipal Association, as well as the Mass Association for Health Boards. So I'll pull out your regulations. I'll check with Mary Ellen about what the highlighted section is with typos and what your hope is in terms of, you know, helping to reduce density and the number of establishments that sell tobacco. I'm happy that Lanesville is taken care of. But I'll also be happy to provide a draft to the board with highlights, as I've done in the past, about what regulation updates should be included that reflect state law, which we are already enforcing, because that's our lowest threshold. You know, the cities and towns can go higher, but they can't go lower.
So Joyce, you make a very good point. Under section violations, in what's in the regulations now, I presume the violation is $100. It's now.
It's $1,000 for a first offense.
Right.
And a 3-day suspension, and then a $2,000 fine and a 7-day suspension, right, and a $5,000 fine and a 30-day suspension. And that's state law, and the state law says you can't go lower, but we're also the enforcement agent, meaning the boards of health. I'm an agent for your board, so of course that's what we're enforcing. But it is better to have not operating in 2 different regulations, but that is the lowest threshold.
Right, but that highlights another thing that we need to address. We need to fix.
Yes, but I think you have to read the entire regulation.
Sorry.
Okay, so Joyce, would you the entire forwarded as well for their review as part of their package.
What was the one?
Mary Ellen, I'm sorry, you're breaking up.
So when you state regs that are not included in our current regulations, I will forward it on to our board members as well.
Okay, I mean, I can send you the state reg independent of an update, but my goal for our next meeting would be to incorporate or marry the 2 regulations so you guys see, you know, what's really new and may require some decisions. Also, just maybe a nuance of a definition, which has gotten better. And then that's really not a big decision, you know, that would be a lowest threshold, and what the intent of your regulation was way back when, but we've just developed the language a little further for better clarification. So I'll highlight those in yellow and green so you'll know what we're talking about.
Okay, so then why don't we do this? You have our current regulation, you said, so when you highlight them, you incorporate them, and then that's what I'll send on to the board for review.
Perfect. Yep.
Great. Thank you.
Okay.
Okay.
Is that all you need from me?
Yes, thank you.
The last thing I will just tell you, I'm happy to report. So Joe, you're the only one who'll remember this, but typically what we do is we would do a full round of compliance checks. This is what the grant and your agreement is. We do a full round of compliance checks. That's where we send a minor into a store to attempt to purchase a product. Our other role is to provide education, information, like if there's an update and signs or anything like that to the stores. And we also conduct a pricing survey, and that's only meant to, we don't have DOR authority, which I know DOR just did a run through in Gloucester, and that was mentioned earlier by somebody that Magnolia was about their tax revenue, that they had products that had not appropriately been taxed. We used to do a quarter of the community each quarter. And it was assigned to us through DPH. That has changed because just of geographical, opportunities, like why drive to Gloucester 4 times a year when we could potentially do it once a year? I don't necessarily think it's a good idea just to only be here once a year, because a lot of times we'll hear from other merchants that there's something going on of concern, and that's an opportunity when we're up in the municipality to take a look at those things, and of course we'd respond to any complaints. But just for the board's information, I did just complete Gloucester in a round of education, inspections, and pricing survey, and everybody was in compliance. There was some small little issues, but nothing major. They were addressed right at the scene when I was there. So just to inform the board and the public that's on the call.
Do we get that?
I'll send it to you just in a memo, the same way I normally would when we're done with doing a compliance check.
Okay, thank you.
You're welcome. You're welcome, and I will plan on attending the next meeting, and Mary Ellen, I'll be in touch with that updated regulation draft. Have a great night.
Thanks, Joyce.
Concerns of the board? Anything? Apart from the fact that the Red Sox suck. Nothing, huh? Okay.
No.
Motion to adjourn?
Motion to adjourn?
All in favor?
Aye.
Zero.
So just to say, I'll be on vacation for 2 weeks.
Have a
Not
good time.
reachable. And I'll be back on the 24th of October. So anything that comes up, just hang on to it till then, for me, anyway.
Somewhere?
California, we're visiting family and friends in California. But I'm not going to be checking my email. Hopefully not, I have a need to be on vacation, so.
Enjoy.
Enjoy.
Thank you, thanks.
All right.
All right,
Thank
we are
you.
adjourned, right?
We're adjourned.
Okay.
We're not recording anymore.
I'm just waiting to exit the webinar.
Exit the
Thank you,
webinar.
No
everybody.
hot mic.
As soon as she exits, exit.